Our last lecture of the week, we are diving into the ethics behind public health and public health policy, how our healthcare system is set up. And we could talk about ethics at any point in any nursing class and in definitely any point in this class. It definitely is a topic that could be woven throughout, but I think it's really important to kind of bookend our discussion and looking at the healthcare system as a whole in regards to ethics, because ultimately the ways that we are making decisions, the ways that we are enacting policies and writing policies, all comes down to our belief system and what we value most. And so ethics help us understand not only our own values, but the value system of those around us, so that we can begin to have conversations where we kind of discuss the core of what's going on behind our decision-making processes, and hopefully begin to find common ground as we ultimately are caring for the health of others. So here's a quick definition of ethics. It includes knowledge about moral living, but it also includes a process of reflection. So it's not just a black and white kind of formula, but it involves a reflecting process. And there are four main bioethical principles that I want you to be very clear about and know how to apply. The first is respect for autonomy. This is the value that people are allowed to make their own decisions about life. So we see this bioethical principle being used very clearly when we talk about the anti-vaccination movement. These are people who are exercising their right to have autonomy and to not vaccinate themselves or their children. And so we always need to make sure that that balances with other principles that I'll be sharing with you. The second one is called non-maleficence. And this is the idea that first we do no harm. So first we do no harm in the sense that we are checking drug allergies before we give medications in a hospital setting. First we do no harm in that we are using medications that are evidence-based to, for instance, take care of someone if they're dealing with a severe COVID crisis. Another example of non-maleficence is the idea of needle exchange programs. This is a very controversial topic versus County City and San Diego. But this is the idea that we don't want people harming themselves unnecessarily when they are engaged in these risky behaviors. And so we would rather create sites where they can exchange their dirty needles with no penalty, with no fee, in order to get clean needles, so that if they're going to continue to do what they're going to do, maybe we can't stop that part, but at least we can reduce the harm involved in using dirty needles. This overall term is what we call harm reduction. I recently read a fabulous article discussing the application of harm reduction to COVID-19 and our guidelines for social distancing and wearing masks, etc. And the quote that I love from this article from The Atlantic said that harm reduction is public health with a dose of empathy. It is acknowledging that we can't always get the most ideal situation or behavior to happen, but we can make put certain steps in place, and that involve a lot of empathy for people's situations, and that is reducing harm. The third bioethical principle is called beneficence. This is where we are not only not doing harm, we are also doing good to others, and that we are maintaining or enhancing human dignity. This argument could be used in the controversial thing that occurred alongside the Hep A epidemic, where we were moving homeless individuals into very specific encampments. So they were losing their autonomy to live where they wanted. We were putting them in these encampments. Were we actually betraying this principle, not only the respect for autonomy, but beneficence as well, because we were decreasing their human dignity in that process? There's a lot of arguments to say that that was a major implication and reason for the Hep A epidemic in San Diego, because we had pushed homeless individuals into very tight quarters that were not hygienic. And the last principle that I want you to be very aware of is distributive justice. So this is the idea that all persons, all individuals, regardless of income, of race, of socioeconomic status, of neighborhood, of zip code, that they all are able to experience, we all have equal distribution of healthcare access, that benefits and burdens are equally distributed, and that one population is not unequally burdened. We are seeing lots of disparities currently with the way that COVID-19 is ravaging communities that are often poor and of non-white races. And so we'll explore that again in more detail here in this course, but distributive justice is kind of saying, no, that's not okay. We want to put a stop to that. And then there's 3 different ethical frameworks I want you to be familiar with. So principles are like very specific values. Framework is like an overarching way to just look at ethics in general. Consequentialism says, look, we need to make decisions based on what's going to produce the most amount of good. So looking at the end justifying the means. Utilitarianism is a kind of subcategory of that, the greatest happiness or good for the greatest number of people. Probably heard that term utilitarianism before. Deontology is very different from this. This is saying that an action is good or bad in and of itself, and the end does not matter as much as the means, so that there are very specific right or wrong things, and we have to abide by that no matter if it doesn't just, if we are not experiencing the greatest amount of good. And then communitarianism isn't necessarily a dichotomy to the other two, but it's just saying, kind of goes along with the idea of distributive justice. We need to be able to balance individual rights with social responsibilities. So this, again, vaccination plays a huge role in communitarianism because it's saying, yes, people can choose not to vaccinate, but then they are putting the greater community at risk, especially in school settings. And so to balance the social responsibility piece, then people can make their own decisions, but then they may not be allowed in certain congregate settings if they don't have vaccination, which protects the greater community. So that's a perfect example of this balancing that needs to happen. In the next few slides, I just have some links that I'd love for you to click on just to be aware of the nurses' stance on ethics and related to public health. American Nurses Association has an excellent quote that I have here, that we are supposed to care, all nurses, not just public health nurses, all nurses are supposed to care about broader health concerns, such as world hunger, such as environmental pollution. We'll talk about that next week. Lack of access to healthcare, violation of human rights, right? And inequitable distribution of nursing and healthcare resources, which unfortunately is a reality with our very fragmented healthcare system. And then the Public Health Leadership Society, which falls under the American Public Health Association organization, they also have very specific ethical principles that they ask us to abide by. What I think is really important in this linked document is that there is a table that links our 10 essential services. So that's the services from the wheel, if you remember, and links those to ethical principles. So that's just really helpful. If you're a visual learner, that would be really helpful for you to check out and see how those connect. So this week, our discussion is relating ethics to current COVID-19 ethical dilemmas. There are a whole lot more of ethical dilemmas out there and currently happening that we're having to face right now. I chose 2 because this is a small class. And so I would like for you to choose in your discussion board this week which one you'd like to focus on. Obviously, we are slowly reopening the economy as we speak. But there's still a lot of debate about how that happens. Should it have happened? Should we have waited longer? Should we have opened sooner? And so your first topic could be talking about the ethical dilemma of, should we be sheltering in place or longer or shorter versus how we reopened the economy? The second one is coming into play where we're talking about, okay, now that we're reopening the economy, we need to do better at testing and tracing. And so some countries are using very sophisticated smartphone apps to track people and make sure that they're able to track their movements and then be able to identify contacts appropriately if they come up positive. There's a lot of issues with privacy that people, especially Americans, are concerned about. And so that's another topic for you to explore. So I look forward to engaging with you on the discussion this week.